You're in the weight loss community and you are taking Mounjaro, Wegovy, or Ozempic, any GLP-1 medication, but you are also facing a prior authorization. So let's talk about diagnosis codes that you can use that fall under the umbrella of metabolic syndrome. So what is metabolic syndrome? Just to put it simple, metabolic syndrome is any risk factor that predisposes you to develop any cardiovascular disease or diabetes mellitus type 2. So I know you are immediately thinking, what are some of those risk factors? Risk factors are abdominal obesity. Now, you know we can't use obesity as a diagnosis code, but I'm just throwing it out there. That is a risk factor. Dyslipidemia, that is high cholesterol or high fats in your blood. Hypertension, that is high blood pressure. Hyperglycemia, that is high blood sugar. Hypoglycemia, that is low blood sugar. There's insulin resistance, that's your body's inability to respond appropriately to normal insulin in the blood. There is pro-inflammatory states that has to deal with the atherosclerosis. Atherosclerosis increases your risk of blood clots. And then there's also prothrombotic states. Prothrombotic states have to do with the coagulation of your blood. Now, coagulation simply means changing a liquid to a semi-solid, okay? Which also puts you at risk for blood clots. Now, keep in mind, I told you want to flood your prior authorization with diagnosis codes. So if you're diabetic type 2, you want to start there. And I'm only listing that, and I feel silly listing it because type 2 diabetics are even getting denied their prior authorization and the medicine was made for them. But if you are, list type 2 diabetics. If you're not, if you've ever been diagnosed with hyperglycemia or hypoglycemia or gestational diabetes, you want to list those. You also want to list insulin resistance. You want to list PCOS. You want to list dyslipidemia. Okay, y'all understand me? You want to list as many as you possibly can. And then also list metabolic syndrome. And you also want to list insulin receptor mutation. If you have a abnormally high amount of hair on your body and have been diagnosed with hirsutism, you want to list that as well. So if you guys are understanding what I'm saying, the more diagnosis codes that you give, it almost puts them impossible to deny your prior authorization. And even if you get denied, you want your prior authorization to at least make it to that medical director's desk. That way a peer-to-peer can be done, and then the doctors can decide whether they deem your request for prior authorization for this medication to be approved. I hope that helps.